Before we dive in, I'd like to quickly mention something important regarding data integrity. The patient's information and clinical matrices shown here are purely for demonstration purposes. We take data security very seriously, ensuring that all real-world deployments adhere to the highest global data protection standards. All right, let's get started with the demo. Access to healthcare should be simple, fast, and universally accessible. Yet, for many patients and doctors today, managing appointments, consultations, and medical records remains a scattered and time-consuming process. At Bacancy, we've dedicated over 14 years to building healthcare software and digital care platforms for organizations worldwide. In this demo, I'll be guiding you through the CarePoint Hospital Management System, a comprehensive web portal designed to streamline hospital operations for administrators, doctors, and patients. Here's a quick overview of what CarePoint has to offer. CarePoint is an all-in-one solution for managing appointments, patient records, billing, and staff. The interface is modern, responsive, and user-friendly, making it accessible to staff and patients of all technical levels. Even without signing in, users can explore the features that CarePoint offers. Let's dive into the feature overview. CarePoint offers a range of functionalities including patient management appointments, clinical notes, and EMRs, as well as ward and bed management, IPD admissions, and billing modules. There's also laboratory and pharmacy management, role-based access control, and analytical reporting for patients and doctors. Now that we've reviewed the features, let's sign into the admin portal and see what it offers for administrators. Here we are in the admin dashboard. You can see an overview of the number of patients, today's total appointments, the number of doctors, occupied beds, and any pending bills. There's also a detailed view of upcoming appointments and recent patients. Next up is the patient view. Here you can get an overall detail about the total number of patients, and you also have the ability to view or add new patients. Let's go ahead and add a new patient. You'll need to enter the patient's first and last name, their phone number, email, and date of birth. You can enter the date manually or use the calendar feature. Next, choose the patient's gender. There are two patient types, outpatient and inpatient. Inpatients are admitted to the hospital, while outpatients are routine visitors for appointments or ongoing care. Let's proceed by adding the patient's address. Additionally, you'll enter the blood group if needed, as well as emergency contact information or insurance details, such as the provider and policy number for urgent cases. Let's save this information. Our new patient has been successfully added. Now you can view the patient's details, including recent appointments and billing information. Next, let's explore the appointment module. Here you get a detailed overview of a particular patient's appointments, and you can also create new appointments. Let's set one up for the patient we just added. You'll need to select a doctor and an appointment date. For this example, we'll choose today's date. Next, pick a time slot. The available slots range from 8 a.m. to 8 p.m. in 1-hour increments. Select your preferred time slot and update the appointment status, whether it's completed, scheduled, or in progress. You can select the appointment status accordingly. The appointment has been created successfully. Next is the clinical notes section, primarily for doctors. However, admins can manage, add, update, or delete notes as needed. The laboratory section allows for adding lab bookings, a functionality available to both admins and doctors. In the new booking section, you can input details for lab tests, including patient name and test type. There are pre-listed tests to choose from, along with booking date, status, and values. From here, create a lab booking. Moving on to staff management, admins can oversee staff information and roles. Admins can add new staff members by entering their first and last names, email, phone number, temporary password, and assigning roles. Available roles include staff, receptionist, pharmacist, and lab technician. Next is managing doctors. You can view, edit, or adjust their availability and add new doctors as needed. Then we have department management. Predefined departments can be adjusted by the admin team as necessary. Next up is billing. In the billing section, you can create new bills for patients by selecting the patient name, appointment, and status. Afterward, items like consultation, lab tests, pharmacy, or services can be added to the bill. You can also include health checkups by adding descriptions, amounts, let's say $100, and applying a GST of 10%. Add the GST, and you'll see the total amount including base price and GST. Now let's add this bill. Here, the total amount is displayed along with payment options. For partial payments, you can enter the amount and payment method. Choose the payment method, enter the reference number and any notes, and record the payment. This completes the billing part. Moving on to GST settings, you can set fixed GST rules for consultations, lab tests, pharmacy, and services. Now on to pharmacy management. Pharmacists can track and manage medicine stocks and ensure everything is in order. Let's look at ward management next. In ward management, you can create new wards. For example, Ward 12. You can assign codes for specific departments and set the total number of wards, say 10. Once saved, the new ward is created. You can also add new beds, like a 15th bed, and save those details. This is how it works. Moving on to IPD admissions, admins can admit patients to beds. Choose a bed, such as in Ward 12, for the patient. Once admitted, the patient's information is recorded. The ward section allows you to view occupied beds and analyze reports. You can see total revenue, patient numbers, completed appointments, and department-specific details. You can also track the number of doctors per department. That's an overview of the admin functions. Now, let's switch to the doctor's portal. Welcome to the doctor's dashboard. Here, doctors can view their patient numbers and appointments for the day, as well as upcoming appointments. In the patient section, doctors can access detailed patient information and manage their appointments. This includes scheduled appointments and their respective time slots. In the clinical notes section, doctors can add notes for any patient based on their appointments. Doctors can note reasons for visits and diagnoses. Next, there's the diagnosis section, followed by prescriptions. Here you can add prescriptions and any other pertinent notes, then save the clinical notes. These notes are now recorded. Notes can be edited or deleted if necessary. Moving to the laboratory section, doctors can manage lab tests and bookings. That's a summary of the doctor's features. Let's transition to the patient's view. With patient login credentials, you can access the patient's dashboard. Patients can see their appointments, total bills, outstanding balances, and detailed views of appointments and bills. This is the dashboard overview. Under My Appointments, patients can track their scheduled visits. In the billing section, patients can view or print their bills. A detailed bill view is available. Bills can also be printed, downloaded, or saved for future reference. Here, the bill has been downloaded. Moving to My Records, patients can access their clinical records for past and ongoing appointments. That's the patient's view. With our extensive healthcare expertise and years of experience in creating secure and scalable platforms, Bacancy is well-equipped to help organizations develop impactful digital solutions. If you're planning to build a next-generation telemedicine or healthcare platform, our team is here to turn your ideas into a reality that patients and doctors will appreciate. If you're interested in a demo of our CarePoint capabilities, please connect with Bacancy. Thank you very much for your time.